performed by a trained professional while in their professional capacity. So who does professional touch?
Some therapists.
You. We do. Doctors, chiropractors, tattoo artists, hairdressers. They've all been trained. They've been trained to perform a particular type of touch. So professional touch is touch that is given by a trained professional in a professional capacity. Got it? Cultural influences. This basically speaks to, and this would be speaking of touch and comfort with touch. So cultural influences. There were some studies done years ago, and they looked at how many times in an hour people touched one another. And where do you think the most touch was going on in Europe?
In Europe.
Where in Europe?
France.
France. Where do you think the least was going on in Europe? England. England. In England, there was hardly any touch going on. The English are so polite, am I right?
Yes.
Very polite. They're the most polite people, and they really have this sense of personal space, right? So they don't like, it's like it would be rude to just touch somebody as much as, you know, touch happens. However, like the French are just like, you know? And they're all over you, right? Does anybody hear this French? So anyway, it's interesting the cultural influences on touch, the amount of touch that's happening, what's appropriate, what's not appropriate. We have to be aware of that because we're going to be dealing with a diverse population. So we should never assume that the people we're dealing with are as comfortable with touch as our culture, right? Cultural influences. While they were doing this study, they also had a grocery store experiment where at the end of the transaction with the customer, the teller would touch or pat or just pat on the shoulder and say, "Thank you, have a nice day." And then those people were all interviewed afterwards, and the people that were touched had an amazing experience at the grocery store. They just loved the grocery store. This is my favorite grocery store. And the people that didn't get touched were just like, you know.
I heard when I used to wait tables that if you touched the people you were serving, they'd give you bigger tips.
I'm sure it's true. I'm sure it's true.
Person pay.
Gender issues. Let's take a few guesses at what this means. It's kind of a loaded phrase, isn't it?
Yeah.
It's kind of because you put issue in there, and it's like, it's a problem, but it's not. It's a very normal thing, but this is the definition we use in our industry to describe somebody who prefers a male therapist over a female therapist, or vice versa. They have a gender preference, but remember, the term is not gender preference, it's gender issues. All right? And that happens a lot, and it's okay. Influence of age on touch. We talked a little bit about this before. We talked about how during different courses, different life stages, phases of your life, touch is more readily received than it is at other times. Elderly folks are touch deprived, so they crave it and they need it big time. And adolescents are also touch deprived, but they don't want it. Usually. They probably do, but they just don't know it. You know? And you know, that doesn't, we're not talking about sexual touch. We're talking about the normal touch that happens in a close family and with friends and stuff. That kind of becomes off limits.